Hello everyone, I am Dr. Rupa, ophthalmologist and lover of all things beauty. And before we get started, I have to ask you, please subscribe to my channel, like this video, comment. I read everything and it really helps me know what kind of content to produce so that I can make videos that will answer your eye, makeup, beauty, health kind of questions. I'm niching down in that area. Anyway, today we are going to be talking about something near and dear to my heart because I suffer from it, which is dark under eye circles and eye bags. So if you want to know some ways to actually prevent those from occurring, keep watching. I'm not going to talk about how to conceal them or makeup tricks because there are a million YouTube beauty vloggers out there who do it way better than I do, so I'm going to leave it up to them. But what I am going to talk about is 5 ways that you can actually prevent under eye bags and dark circles. So first thing, a lot is genetic. And right now I'm not wearing any makeup. I just have moisturizer on my face and that's it. And I unfortunately do have some dark circles thanks to my father. And you might have a parent that has that too. That is just, there's genetics. So if this is new, like you're not someone that's had dark circles or under eye bags for your entire life or for a large part of your life, if this is some new change, it might be related to hypothyroidism. There are cardiovascular problems that can also cause this. So you do want to check in with your medical doctor just to make sure if you feel like this is a new thing. So here you can kind of see my under eye bags. They're not awful. I'm 43. This is me without any makeup. And you can see a little bit darkening underneath the eyelids. That's quite common for people that are Indian. I think that melanin just makes it a little bit harder for us. So that is mine. I'm gonna slap on a little bit of makeup right now and get back to you in a second. So we already talked about genetics, which you got no control over. But there are some things that we do have control over that can make the under eye bags and dark circles less. So the first thing is allergies. If you have seasonal allergies, or like if you live here in Hawaii, then you kind of have allergies year round, which is me, that can really exacerbate the dark circles under your eyes and the bags. And there's a couple reasons for that. Your eyelid skin, especially underneath the eyes, is the thinnest skin in your body. And since it's so thin, you actually see the blood vessels underneath it very easily. And that's part of the problem when you have allergies. You're actually seeing the dilated blood vessels underneath and it can look like it's very dark in there. In ophthalmology, we call them allergic shiners. I have a ton of pediatric patients that we treat with that and they just look like those raccoon kind of eyes because they're so dark and congested underneath from the blood vessels being dilated from all the inflammation. So that inflammation makes the blood vessels leaky. So the first thing that you can do to minimize that is to decrease your exposure to allergens. Oftentimes what I'll tell patients is if you know you are allergic to pollen and grass, and obviously you can't do much about it, there are shots that you can do, but the simplest thing is when you come inside is to wash your face. I know it sounds very easy, but you want to get rid of all of the allergens that's just kind of around your face, causing you to erupt into that inflammatory cascade. So very simple thing. Second, just follow up with your medical doctor. If the over-the-counter remedies are not working, they might be able to do allergy testing and really specifically get at what it is you're allergic to so that you can avoid it. I've seen patients that are allergic to rabbits or dogs that they never knew that they were allergic to, and once they minimize their exposure to those things, then their under eye bags and all of their other symptoms just vastly improve. So I'm always for trying to avoid something if possible rather than treating it with medication. Second, if you do have seasonal allergies, don't rub. Rubbing the eyes, number one, causes that inflammatory cascade, causes cytokines and all these different chemicals to release. So it makes your eyes itchier and makes you want to rub them even more. Plus that rubbing motion, just that traction on the thin skin of your eyelid, it just is going to make it look really dry and it's going to make everything look a lot worse. So try not to rub your eyes, just treat the underlying condition if you can see your doctor for that. The second thing that you can do is sleep more. If you can sleep about 9 hours a day, I know, who does that? I certainly don't. And when you are sleeping, if you're lying nice and flat with just a little bit of an elevation to one side, it helps the fluid from underneath your eyes pool down towards your feet, so that it doesn't just build up into those sensitive areas around your eyes. If you can increase your sleep, it's just going to be better for you, the rest of your body, as well as your appearance. You know, these are all modifiable factors, meaning stuff that you've got control over, that you might be able to do without medication to make your eyes look better. Third, the other thing that really causes dark circles under the eye, one is because the skin is so thin, so you see all those blood vessels and the inflammation under it. But the second is pigment. You get a lot of pigment underneath the eyes. A part of it is genetic, like Indian women, such as myself, do have a tendency to have more pigment under the eyes than other women. So what I do is I'm very, very religious about sunscreen application, because I want to minimize as much melanin increasing underneath that area as possible. So I'm really, really good about putting on sunscreen. And I know a lot of people are very nervous about putting sunscreen around the eyes because it can migrate inside the eyes. I use this SkinCeuticals, the physical sunscreen, which is specially formulated for underneath the eyes. It's got a slight pigment to it. It's by SkinCeuticals, and it's SPF 50, which is amazing. It does have a little bit of a tint to it. So of course for me, it's a little bit pale for my skin color, but you can kind of blend it in and it's okay. And I know people that are blonde and very fair skinned with blue eyes, and this is fine for them too. So I would definitely recommend, if dark circles are a concern for you, make sure you are putting on sunscreen every single day. That's why my skin looks like this, and I'm 43. Even my years of living in New York, I put sunscreen on every single day, even in the winter. Just an extra little tip there. The other thing that you can get a handle on is your salt intake. Listen, I hear you. I love salty food. My husband's always telling me I throw extra salt in everything. I dunk my sushi into so much soy sauce that he's appalled. Apparently you're supposed to just like brush it, and I like totally dunk it. But anyway, now that ramen here in Hawaii, that's got a lot of salt in it. Just food in general and the American diet has a ton of salt in it. So MSG, salt, that's all going to increase the fluid absorption and just get the fluid to just retain right there, giving you those bags. And you see it. I know you see it. So hold off on that ramen or that super salty steak, and you'll notice a big difference if you can just clean up your diet a little bit and make sure you're drinking plenty and plenty of water. That's going to help tremendously. Okay, my fifth one's kind of a little bit silly, but it's don't cry before you sleep. Have you noticed when you cry, your eyes get all puffy? There's a reason for that. The tears when you are crying emotionally are not as salty as your normal reflex tears that are pumped out of your eyelid when you blink. So as a consequence, you remember osmosis? Here's a little picture for you. Remember osmosis, where water is going to go from where it's more concentrated to less concentrated? So since the tears aren't as salty, there's a lot of water there, and that's going to go into an area where there's not as much water, which is around your eyelid skin. That periocular tissues just is going to soak up all that extra fluid, and then you wake up with very, very baggy, puffy eyes. So those are 5 things that you can actually modify to be able to decrease the look of the eye bags and dark circles. Now remember also, as you age, it's just going to happen naturally. The mid-face just loses structure, and we get fat herniation of, they call them festoons in ophthalmology as well. And there's all different kinds of treatment for the actual herniation of the fat. You can do Botox there. You can do fillers like I've done here in this picture. A hyaluronic acid filler like Restylane in the tear trough area is really nice. Or of course, there's different concealers and makeup. There's even lasers that can help with the crepiness of the skin. And then ultimately, there's a lower lid blepharoplasty, where you can actually make an incision through the conjunctiva, the inside part of the eye, so they don't even necessarily make a incision on the skin, and they will cut down or usually burn down the fat and just get rid of those fat pockets that are herniating through. So that's just some quick treatments, surgical treatments that we do as ophthalmologists, some ways to decrease your dark eye appearance, dark under eye bags. Let me know if you found this helpful. Thank you guys so much for watching, and if you want to check out some of my other videos, please like and subscribe to this channel. I really appreciate it. Mention anything that you would love to see down below in the comments. I read every single one. And until next time, mahalo, I'm Dr. Rupa.